I'm coming to you from the Stanford Grand here in Glenelg at the National Conference, our 17th National Conference. So stay tuned because next year is our 20th year of AAMT / Massage and Myotherapy Australia, and there's a big announcement about where Conference 2023 is going to be.
So this brings us to the conclusion of our formalities, although there is one more announcement that I'm honoured to share with you all. We are very excited to share the news that we are already planning our 20th year conference for 2023. We are partnering with Massage New Zealand. Hang on. We'd like you all to get your passports ready. We're heading to Auckland, New Zealand. Woo!
Through this tomokanga lies a world that's waiting to be wandered. See sopranos and songbirds, where waves and sound waves collide, where you can acquire a taste for lots of tastes. Spend time with great company. Look back, look forward, listen. Hear that? Tāmaki Makaurau ka rangara. Auckland is calling.
Hello, I'm Dr. Amy Steele. I'm from the Australian Research Centre in Complementary and Integrative Medicine at the University of Technology, Sydney. And I'm joined by Dr. Nikki Monk.
Hello, I'm Nikki Monk. I am an associate professor at Indiana University School of Health and Human Sciences and interim chair, and I'm also a trained clinical massage therapist. I'm very excited to be the MMA fellow for the Arkham Leadership Training Program, and I'm so glad to see you again, Amy.
You too, Nikki. And, after our last conversation that we had about practice-based research networks, I thought it would be really great this time to talk to you in a bit more detail. I know we mentioned it last time, but about PRACI, the PBRN we have here in Australia, which has got a really great representation from massage therapists. And just share with you a little bit about what we've done so far and the sort of research that we have gathered around massage therapy and that sort of thing. Would you like to do that?
I would, and remind me too, but I just want to give a little plug to this. PRACI is a very well-known practice-based research network, or PBRN, that there are several that are in development that are modeling themselves after internationally. And I know that we have one here in the States that we are looking at modeling after PRACI. So yes, now PRACI includes all manner of complementary and integrative health professionals, right? But massage therapists are most represented, and myotherapists?
Absolutely. So it's got at the moment about 14 different complementary medicine professions in there, but yes, massage therapists make up at least definitely more than half. So they're a really strong presence in the PRACI membership base, which is really fantastic. It's great to have that level of commitment and involvement and interest from the massage therapy community in research.
And so, what kind of information is gathered from the PRACI members?
Well, the PRACI, of course, is set up in two different ways. One is that we undertake a survey of members to gather information about them, their practice, so we can get a nice idea of the workforce. And that data is then also being able to be used by researchers who'd like to undertake research using PRACI to help us identify the members that are most appropriate to be involved in their research. So that survey serves two purposes, but we've got some really great information about the massage therapy profession, which can be really useful to help communicate to people outside of the profession about what the practice does, but also for the profession itself to understand what the sort of general trends and patterns are. And then individual practitioners can have a look at that data and think, wow, that I do less than that, I do more than that, that's very similar to me, and kind of understand where they sit in the mix of all of the other massage therapists that are out there.
So do we have some information from PRACI to give us a snapshot of understanding of the massage and myotherapy workforce and their practices?
Absolutely do. I've just put a little image together to share with you.
Oh, excellent.
This is just a summary of some small snapshot, but just to give you a sort of indication of where this the massage therapy profession sits in Australia from the survey that we conducted in 2017 for PRACI. So what we found out of that was that on average, massage therapists are in practice 5 days per week. So this is actually, interestingly, from our other PRACI data, it's actually a lot more than a lot of other complementary medicine practitioners who are on average part-time. So it shows that massage therapists, when they are in practice, are regularly seeing clients. In that 5 days a week, about 23 hours is providing clinical care. So that's not to say that they're not working the rest of the time. A lot of them will be private practitioners running their own clinics, doing book work, managing appointments, possibly managing the cleaning and other aspects of their business. So the 23 hours of that 5 days is spent in the with clients in the room with their hands on bodies most of the time. We also know from that data that most therapists are in solo practice. So massage therapists are in community in their own practice. Less than a third, closer to a quarter, are in maybe in another practice with a group setting, but the majority of them are only in private practice by themselves. And this is an important finding for the massage therapist to understand as well, that how do massage therapists work in with other health professionals? It's not quite as easy when you're in practice by yourself. And what can we do as a profession to ensure that people have got the community and network and support from colleagues that they need? We also know that they see on average 21 clients per week, 25 new clients per month. So that's just good to give a bit of a general trend or pattern of client engagement with massage therapists. So that's just a couple of little snapshot information about about massage therapists. And then we also have their hourly rate, which in 2017 was an average of $83 per hour for their services. So now, whether or not that's changed in the last 5 years is something that we will be exploring.
Well, it seems to me, too, that having this data from 2017 gives that snapshot of very pre-pandemic pieces, and there's potential opportunity to do a little bit of a impact discussion or consideration from COVID that has made such huge effects on people's practices and how they're able to access their client base or their patient care and the like. And I see on your icon there that PRACI is getting ready to do a bit of a relaunch. So can we expect that this data will be refreshed soon?
Absolutely. It's actually really exciting for us. So PRACI is now solely housed at the University of Technology Sydney at Arkham. And part of that is a relaunch. That means that current members will be invited to complete the survey again and renew their commitment to being involved in PRACI, but also provides openings for other massage therapists and other complementary medicine practitioners who didn't have a chance to join for whatever reason the first time we launched PRACI, for them to step in and be involved as well. So we will be able to capture a lot of this information about and look, as you say, compare with the previous data around what massage therapy, how practice may have changed in that time. So it's very exciting, and it's actually going to be launching in the next few, in early April. So
excellent. So that's coming really soon.
Yeah, very exciting. So we'll be sending information out on social media and out through professional associations like Massage Myotherapy Association, and we're really excited about sharing this information, sharing the opportunity for massage therapists to step up and be involved and to complete the survey, which will provide some good workforce data, but also by doing so, you're able to be included in other future research that involves massage therapists in a more meaningful way. So that is excellent.
And I tell you what, Amy, with the MMA getting ready to have their conference or the conference season occurring and their focus on mastery, this is a wonderful opportunity and time for massage and myotherapy clinicians to think about their engagement in research, whether they want to intersect with research as a participant, as a study participant, or potentially as a site for future research. The opportunity for them to get involved is really high with these PBRNs. Plus, it helps to give a better snapshot, hopefully the research that's being done, a better snapshot for our clients and for our patients and how we are impacting the health of our community. So I'm so excited for the relaunch of PRACI. And just as another plug, we've got a simultaneous relaunch of the United States, or the Northern America, I guess, our PBRN MassageNet. And so I look forward to us having a future discussion as we
that does sound
compare
very
notes for these relaunches.
yeah. All right. So we'll come back to that. When do you think you'll be doing that? We'll come back to it and have a chat about that.
So May is when we're doing our formal rollout. We've got a slow roll happening right now with our former members and getting back in contact with them. And so we should be looking really good about October, November. So let's plan that conversation.
That sounds great. All
Great,
right,
Amy.
thanks a lot, Vicki. Lovely seeing you again, and we'll speak soon on something else equally as exciting and interesting, I'm sure.
Absolutely. Thanks, Amy.